Recall that early dumping symptoms occur 10 to 30 minutes after meal. Early dumping syndrome is the most common type of dumping syndrome and have both vasomotor and gastrointestinal symptoms. The symptoms of early dumping syndrome occur due to three pathogenic mechanisms: due to rapid chyme transit, due to fluid shift, and due to hypersecretion of gastrointestinal hormones. The first mechanism is rapid chyme transit. This mechanism causes clinical symptoms as abdominal cramps, bloating, postprandial abdominal pain. All these symptoms are related to abdominal symptoms of early dumping syndrome. The mechanism of rapid chyme transit is a response to voluminous properties of chyme. When voluminous hyperosmolar chyme enters the duodenum, this massive portion of chyme causes abnormal distension of duodenal wall. This abnormal distension of duodenal wall causes dumping symptoms as abdominal cramps and bloating. The distension of duodenal wall is sensed by enteric nervous system. Enteric nervous system becomes activated and reacts through local pathways by increase in bowel contractility that clinically manifest as postprandial abdominal pain. Also recall that adaptility of enteric nervous system is unique for every human. Some patients with high adaptility of enteric nervous system adapt quite easily and faster to any changes in chyme. With adaptation, dumping symptoms become milder, and in some cases, adaptation eventually results even in complete resolution of dumping symptoms. But in patients with low adaptility of enteric nervous system, these symptoms last longer and can be very severe. So this mechanism hugely depends on enteric nervous system adaptility. The second mechanism is fluid shift. This mechanism causes vasomotor symptoms of early dumping syndrome. Fluid shift mechanism is a response to hyperosmolar chyme properties. For example, how this mechanism can regulate chyme osmolarity in case of just hyperosmolar chyme. When hyperosmolar chyme enters duodenum, duodenal osmoreceptors sense this hyperosmolarity, and to decrease these hyperosmolar chyme properties, organism use fluid shift mechanism. Overall, the concept is that fluid moves from general circulation to intestinal circulation, and then some portion of this fluid is secreted into the intestinal lumen to decrease chyme osmolarity. So basically, fluid shifts from general to intestinal circulation. In order to shift fluid from general to intestinal circulation, intestine use hormonal and nervous regulations. First of all, intestine secretes two hormones, its vasoactive intestinal peptide and serotonin. It's the key hormones in fluid shift mechanism. They work in synergy and cause local vasodilation of intestinal blood vessels. Also, in response to hyperosmolar chyme, parasympathetic nervous system becomes activated and causes additional vasodilation. The more dilate are intestinal blood vessels, the more blood is going to intestinal circulation, and the more blood volume intestinal veins can store. And increase in blood volume in intestinal circulation called splanchnic blood pooling. To illustrate this, its arteries, arterioles, capillaries, venules, and veins. Arteries serve as major blood conduits providing flow. Recall that according to Ohm law, flow is equal to pressure difference divided on resistance. Arterioles serve as major regulators of blood flow. They regulate blood flow by changing resistance in cardiovascular system. Recall that resistance is inversely proportional to the force power of radius. And arterioles by their contraction or dilation change their radius, and this affects blood flow. For example, with vasodilation, radius increase, thereby resistance decrease and flow increase. Veins serve as major collectors of blood, because they have very high compliance, which basically means they can easily dilate. And when intestine secretes vasointestinal peptide and serotonin, these two hormones cause massive vasodilation that affects primarily arteries. The radius of arteries increase, and with increase in radius, arteries resistance decrease, and with decrease in resistance, flow through arteries increase. Also, parasympathetic nervous system become activated. Parasympathetic nervous system cause additional vasodilation, and also it causes relaxation of precapillary sphincter in arterioles. So the radius of arterioles increase, and with increase in radius, resistance decrease. Thereby flow through arterioles increase. So the more blood from arteries will come initially to capillaries and then to venules and finally to the veins. And because veins have very high compliance, they can store a massive volume of blood. and this accumulation of massive volume of blood in intestinal circulation called splanchnic blood pooling. So fluid shift mechanism is mediated by two major hormones, its vasointestinal peptide and serotonin, and also by parasympathetic nervous system activity. This causes fluid shift from general to intestinal circulation that results in splanchnic blood pooling. But the potential side effect of fluid shift is that increase in intestinal blood pooling creates relative hypovolemia in general circulation. To explain this, there is heart, and from left ventricle blood is going to aorta, and then by sets of parallel arteries blood is distributed simultaneously among various organ circulations. Its cerebral, coronary, renal, splanchnic circulations, also skeletal muscles and skin. Then blood by veins through vena cava going to right atrium. Let's assume that cardiac output is 5 liters per minute. And for example, in normal state, 25% of all cardiac output is delivered to renal and splanchnic circulations and also to skeletal muscles, 5% to coronary circulation and skin, and 15% to cerebral circulation. But during and after meal, especially in case of hypersmolar chyme, blood delivery to splanchnic circulations increase. Recall that increase in blood delivery is mediated by two hormones, its vasointestinal peptide and serotonin, and also by parasympathetic nervous system activation. And this results in 200 to 300% increase in blood volume in splanchnic circulation. In case of voluminous hypersmolar chyme in dumping syndrome, this increase in blood volume in splanchnic circulation can be so significant that it creates hypovolemic state in general circulation. For example, initially cardiac output is 5 liters per minute, and 25% of all cardiac output, which is 1.25 liters, is going to splanchnic circulation. But when voluminous hypersmolar chyme enters the duodenum and in response to this splanchnic blood pooling occurs, the amount of blood in intestinal circulation increased by 200 to 300%, and now has become, for example, 3 liters. It suddenly occurs that the amount of available blood volume in general circulation is only 2 liters per minute, so the blood flow to other organ circulations decreased. Especially important that it can affect the perfusion of cerebral circulation, that is very sensitive to any decrease in blood perfusion, and this can result in dramatic side effects. It's called relative hypovolemia because there is no loss of blood from cardiovascular circulation. But because massive volume of blood is pooled in splanchnic circulation, this blood volume becomes unavailable for systemic circulation. So in fact, in this case there is hypovolemia without blood loss, just redistribution of blood, that's why it's called relative. And also activation of parasympathetic nervous system causes decrease in systemic vascular resistance. It's important because these two factors, relative hypovolemia and decreased systemic vascular resistance, cause decrease in blood pressure. Recall that blood pressure is equal to cardiac output on systemic vascular resistance, and cardiac output is equal to stroke volume on heart rate. With hypovolemia, stroke volume decrease, and reduced stroke volume cause decrease in cardiac output, that directly cause decrease in blood pressure. So obviously the bigger is splanchnic blood pooling, the more severe is hypovolemia, and the more significant is fall in blood pressure. And activation of parasympathetic nervous system causes decrease in systemic vascular resistance, and decrease in systemic vascular resistance directly causes decrease in blood pressure. So basically fluid shift affects all factors that determine blood pressure. And high pressure baroreceptors as well as low pressure baroreceptors, so-called cardiopulmonary baroreceptors, sense this fall in pressure and they react. High pressure baroreceptors cause increase in heart rate. By increase in heart rate, they correct cardiac output, also they increase cardiac contractility, that cause increase in stroke volume, that also cause increase in cardiac output, and they cause activation of sympathetic nervous system, and activated sympathetic nervous system cause increase in systemic vascular resistance. Cardiopulmonary baroreceptors also increase sympathetic nervous system activity, that subsequently contributes to increase in systemic vascular resistance. So by these effects, compensatory mechanisms keeps blood pressure constant. All these effects occurs in case of just hypersmolar chyme, even without significant structural pathology, and in this case they are mild and do not cause clinical symptoms. But in dumping syndrome, chyme is not just hypersmolar, but also voluminous. Voluminous basically means massive, and because it's massive portion of hypersmolar chyme, intestinal secretion must be also massive. And to provide such intestinal secretion, humoral and neural regulations become overactivated. So first of all, in response to voluminous hypersmolar chyme, intestine massively secretes vasointestinal peptide and serotonin, and also parasympathetic nervous system become overactivated, and this causes massive vasodilation of intestinal blood vessels. This results in a significant fluid shift from general to intestinal circulation that creates massive splanchnic blood pooling, that subsequently creates hypovolemic state in general circulation. So there is severe hypovolemia, and in case of dumping syndrome it can be even determined in blood analysis by increase in hematocrit. Moreover, rise in hematocrit is one of the criteria of early dumping syndrome, and also hypovolemia through decrease in stroke volume causes decrease in cardiac output that results in fall in blood pressure. And this fall in cardiac output due to relative hypovolemia also aggravated by overreaction of parasympathetic nervous system that through decrease in systemic vascular resistance also cause fall in blood pressure. So there is significant hypotension, which is first of all central symptom in fluid shift mechanism and also its diagnostic criteria for early dumping syndrome. This significant hypotensive state provoke overreaction of baroreflex pathways. First of all, because hypovolemia causes significant decrease in cardiac output through decrease in stroke volume, to correct cardiac output, baroreceptors must increase heart rate, and to compensate significantly decreased stroke volume, increase in heart rate must be also significant. And this causes another dumping symptoms. First of all is tachycardia, which is also the diagnostic criteria for early dumping syndrome, and also it causes palpitations. In addition to this, high pressure as well as low pressure baroreceptors induce overstimulation of sympathetic nervous system, and overstimulated sympathetic nervous system causes diaphoresis, which is excessive sweating, because recall that sweat glands are innervated by sympathetic nervous system. But in dumping syndrome, even such overstimulation of sympathetic nervous system sometimes is not enough to keep normal values of blood pressure. So if stress that is caused by voluminous hypersmolar chyme mildly prevails over compensatory mechanisms, this causes mild hypotension, and mild hypotension manifests with symptoms as weakness, fatigue, dyspnea, dizziness, lightheadedness, and also with a very specific for early dumping syndrome clinical symptom when patient complains that he needs to lie down after meal intake because he feels unwell. All these symptoms are caused by decrease in brain perfusion due to low blood pressure, because recall that brain tissue is very sensitive to any changes in blood flow. If stress totally overwhelms compensatory mechanisms, this causes severe hypotension that manifests with episode of faintness or even syncope. So in this case there is critical deficit in brain perfusion. This results in brain ischemia that manifests with such severe symptoms. So basically all symptoms caused by fluid shift mechanism are related to vasomotor symptoms of early dumping syndrome, and these symptoms can be divided on two groups. One group of symptoms occur due to compensatory overactivation of sympathetic nervous system. It's palpitation, diaphoresis and tachycardia. And the second group of symptoms occur due to fallen blood pressure. It's mild symptoms as weakness, fatigue, dyspnea, dizziness, or it can be severe symptoms as faintness or even syncope. The third mechanism is caused by hormonal hypersecretion. In response to a voluminous hypersmolar chyme, intestine massively releases gastrointestinal hormones that cause some of the dumping symptoms. It's primarily vasointestinal peptide and serotonin, and to a lesser extent Bradykinine. There are two major hormones that are secreted by intestine. It's vasoactive intestinal peptide and serotonin. Vasoactive intestinal peptide have three effects. It causes increase in bowel contractility that causes postprandial abdominal pain. Also it increases chyme transition rate. The problem is that in dumping syndrome chyme transition rate is already increased, so vasointestinal peptide aggravates it. By the way, that is the reason why in dumping syndrome liquids are more dangerous than solid food, because liquids have the higher transition rate. But the main effects of these hormones in relation to dumping syndrome It's intestinal vasodilation that causes splanchnic blood pooling, and stimulation of electrolyte secretion rate. These two effects contribute to fluid shift mechanism. Serotonin also causes intestinal vasodilation. Basically, these two hormones are working in synergy and cause vasodilation of intestinal blood vessels that results in splanchnic blood pooling that creates this fluid shift mechanism. Also, it was determined that in postoperative period, patients with dumping syndrome have elevated bradykinin level. Bradykinin also causes vasodilation, but the specific feature is that the site of bradykinin effect is not in intestinal circulation, but the peripheral tissue. So bradykinin also causes fluid shift, but fluid shifts from plasma compartment to peripheral tissues. This peripheral fluid shift is not so substantial as intestinal fluid shift, but it aggravates hypovolemic state in general circulation. Also, bradykinin increases blood vessels permeability, and peripheral vasodilation with increase in permeability of blood vessels can manifest as flushing, which is also the symptom of early dumping syndrome.